Welcome to the Everything Epigenetics podcast, where we discuss DNA regulation and the insights it can tell you about your health. I'm Hannah Went, and I'm the founder of Everything Epigenetics. Today, my guest is Dr. Terrie Moffitt. We are going to be answering the question, how fast are you aging? And I know that may come with a lot of loaded questions, but believe me, we will help you and walk you through it. A quick introduction to our guest today. Terrie Moffitt is the Nannerl O'Keohane University Professor of Psychology at Duke University and the Professor of Social Development at King's College London. Her expertise is in the areas of longitudinal methods, developmental theory, clinical mental health research, neuropsychology, and genomics and behavioral science. She is uncovering the consequences of a lifetime of mental and behavioral disorder on processes of aging. She is the Associate Director of the Dunedin Longitudinal Study, which follows a 1972 birth cohort in Dunedin, New Zealand. This will be our main focus today. She also co-founded the Environmental Risk Longitudinal Twin Study, or ERISK study, which follows a 1994 birth cohort in the UK. Dr. Moffitt also is a licensed clinical psychologist with specialization in neuropsychological assessment. She has a published record of collaboration with criminologists, economist, geneticist, epidemiologist, sociologist, demographers, gerontologists, statisticians, neuroscientists, medical scientists, and even ophthalmologists and dentists too. Dr. Moffitt's work was recognized in 2018 by election to the National Academy of Medicine. She holds honorary doctorates from the Catholic Universiteit in Leuven, Belgium, and the Universiteit Basel in Switzerland. For her research, Dr. Moffitt has received both the American Psychological Association's Early Career Contribution Award and Distinguished Career Award. Dr. Moffitt was also awarded a Royal Society Wolfson Merit Award, the Klaus Grau Prize, and was a recipient of the Stockholm Prize in Criminology, National Alliance for Research on Schizophrenia and Depression Roan Prize, the Klaus J. Jacobs Research Prize, and in 2022, the Grawemeyer Prize. Her service includes serving as chair of the Board on Behavioral, Cognitive, and Sensory Science at the National Academies of Science, Engineering, and Medicine. She is also the chair of the NIA Data Monitoring Committee for the Health and Retirement Study, and even the chair of the jury for the Klaus J. Jacobs Prize in Switzerland. She is a fellow of the British Academy, Academy of Medical Sciences, in Academia Europa, Association of Psychological Science, American Society of Criminology, and the National Academy of Medicine. Dr. Moffitt attended the University of North Carolina at Chapel Hill for her undergraduate degree in psychology. She continued her training in psychology at the University of Southern California, receiving an MA in experimental animal behavior and a PhD in clinical psychology. She also completed postdoctoral training in geriatrics and neuropsychology at the University of California, Los Angeles Neuropsychiatric Institute. In her spare time, she works on her poison ivy farm in North Carolina. I've been very lucky to work with Dr. Terrie Moffitt over these past couple of years through my position with True Diagnostic, and it is truly an honor to have her on my podcast. Please enjoy. Welcome to the Everything Epigenetics podcast, Dr. Moffitt. Thank you so much for being on with us today.
My pleasure. Looking forward to it.
Yeah, we're just going to, jump right in here. But before we get started, I want to hear more about you. You have this H-index score of 210. I believe you're in the top 100 for this, and I'm sure you may be higher now. I just did a quick Google search and pulled it from Google Scholar this morning. And for those who are listening who may not know, and Dr. Moffitt, feel free to describe this a little bit better, but the H-index is an author-level metric that measures both the productivity and citation impact of publications. And according to Hirsch, who is the person who really created this score, a person with 20 years of research experience with an H-index of 20 is good, 40 is great, 60 is remarkable. So again, 210, I think that's amazing. So just tell us a little bit about that, your journey, what have been the key turning points for where you've gotten today?
Okay. Well, thanks for bringing that up. That has been Santa's little present to me this week to reach 210. So I'm excited about it. That just means that I have 210 papers that have been cited 210 times by other scientists. So that's way cool. A lot of people who have a very high H index, people think that they have a huge team, a huge lab with lots and lots of postdocs and lots of PhD students. Ours is actually quite a small shop. It's very boutique-y. We have about 12 or 15 staff and trainees at Duke University at any particular time. But we do incredible, team science. So we really, really work as a smooth, well-functioning, well-oiled team, and also with our team members who are in New Zealand as well. We like to think it's kind of small but beautiful. So I got my start, just very briefly, by joining a longitudinal study in New Zealand of all the babies born in one town in 1972. The town's name's Dunedin. I started there as a postdoc in the late 1980s, and my first expertise at that time was in adolescent mental health. And I continued studying mental health for quite a few years. But as the study members grew older, I had to sort of grow with them. So I had to start studying aging because that's the most important thing that's happening in their lives. So in 2007, I got my first grant from the National Institute on Aging, and we really pivoted, and we've been studying aging ever since, and mainly aging during biological aging and during midlife.
Great introduction. Thank you for that. And I love that you brought up that Dunedin longitudinal cohort, because that is going to be our main focus today, right? How fast are you aging? And even before that, can you actually measure how quickly you're aging? This idea of your pace of aging. So I know you've developed this blood test that tells you how many months you're aging biologically per one chronological year. For example, you gave me one really great one through email. You could be aging 14 months per year right now, which is too fast, right? Or you could be aging 11 and a half months per year, which is going to be a half a month slower, which is great. So this is called that DunedinPACE. Can you give our listeners just an introduction to this great tool before we get into the details? And then we'll go further into how it was created.
Okay. Well, it's called DunedinPACE, as you said, and that PACE Dunedin stands for the city where all of the research participants in our study were born and grew up. And PACE stands for the pace of aging calculated in the epigenome. So, as you said, you can be on this measure aging slow or aging fast. What it tests really is how fast you're aging at the moment. So it's a lot like a speedometer. It can tell how fast you're going right now. And that's kind of special in this field. It came out in 2020, so relatively recently. It's already been studied by more than 30 different research teams working in 6 different countries, studying over 30,000 research participants. And so I'm really excited about how the field has embraced the measure, and the research that's coming out is adding to our estimate of the validity of it. It looks like people who are aging fast on it tend to have the early onset of multiple diseases. They have elevated risk of Alzheimer's, dementia. They have more rapid physical and cognitive decline, and early death, unfortunately. So it appears that although the measure is new, it is amounting a scientific literature that is consistent with it being useful.
Definitely. And I think it's having a huge impact, not only in the longevity and aging space, but just health in general, and even preventative health, right? There's that idea, if we can actually prevent the onset of this accelerated aging, or, just stop that accelerated aging altogether, then that will add a huge value in terms of the quality of life that we may be able to have. So I love the DunedinPACE algorithm. And for those listening as well, I always get this question, so they may be thinking the same thing. And am I pronouncing that correctly, Dr. Moffitt? Dunedin?
Yes, Dunedin stands for means New Edinburgh in Gaelic.
Gotcha. Yeah, because I always I talk to several people about this algorithm sometimes who are in Dunedin, Florida, too. So
Right.
I'm always asking about the pronunciation and the location in Florida.
And two cities with the same name on the opposite points of the globe.
Exactly. So how did you create this DunedinPACE? And maybe even before you answer that question, a lot of people see in the literature the Dunedin POAM. So could you differentiate Dunedin POAM with DunedinPACE?
Yeah, and that's really simple. Because we have been following these people all born in 1972, there are 1,000 of them. 94% are still taking part after 5 decades. And we track them every 5 years, bringing them into the clinic, and they stay for a full day. And we study their physiological health and conditioning. We use those biomarkers to then estimate how fast their entire body is aging. So we're tapping into their cardiovascular health, their lung health, their muscles, their immune system, their kidneys, metabolic system, even their teeth and their gums. And we're adding vision and hearing to the model, and we have brain scanning as well now, so that it will only get better. The Dunedin POAM was an early version of the measure when we had only tracked them up to age 38. But since then, we saw them again when they were age 45 in 2019. So we added more data to our model to really improve its precision. And we've been funded by the National Institute of Aging to follow up the cohort again. Starting next year, they'll be 52 years old. And so in a couple of, 18 months or a couple of years, we'll have even another version that's even better. So we've got the more data that we get, the more precise our estimates can be.
Exactly. And I always think it is mind blowing. You said you have a 94% retention rate. Was that
That's right? Yes.
Yeah. And, correct me if I'm wrong here as well, but an excellent or like a good retention rate is usually around 60% typically in science.
Well, retention rates for studies that have been started more recently, historically, the retention rates are poorer. And that's simply because people today don't want to take part in research. They don't want to be bothered. They don't want to risk their privacy. And people are living in a flood of information these days. So taking part in a scientific study doesn't seem that appealing to them. This particular study is a bit different because it did start back in the 1970s. Study members have been in it all their lives, and they tend to view themselves as sort of like an Olympic team representing their small country overseas. So they're bringing medical knowledge to the rest of the world and punching way above the weight of a small country like New Zealand. So they're proud to be in the study. We're proud to have them. And we bend over backward to make it easy for them to take part every time.
Great. And that has to feel good, having that unity of being in that group and being followed up with and seeing all your different health metrics. I know I would definitely be interested in some type of opportunity if I had the chance.
There's an enormous amount of goodwill between the scientific team in New Zealand and their research participants.
Right. So could you talk a little bit about what's so unique, what's so different from what you've been doing in terms of following a group? I know you can talk about some of those exposures and different things like that over the decades. What's really unique just about following these people for almost, 5 decades now?
Well, what's special about it in terms of developing a measure like DunedinPACE or the old version Dunedin POAM is that there are plenty of other measures referred to as clocks that measure aging and do it quite well. And those are they're trained on date of birth, how old a person is, or on outcomes such as mortality, those kinds of things. those generate very accurate clocks. Just remarkably accurate. And those are the early generations in this work. The way that this particular project is different is that we study change. So by tracking biomarkers, 19 biomarkers, tracking all the different organ systems of the body over so far age 20, age 32, age 38, age 45, and next year age 52, we're really studying the synchronized decline of organ systems, the deterioration of the integrity of the body that happens slowly and gradually with aging. So we know it's not sickness because that would be short term, whereas this is a trajectory that is going in the same direction from your 20s until your 50s.
Right. So you have this very unique cohort. They're being followed. You're getting all of these types of measurements. My favorite one, when I talk about this with some people, they're always surprised about the gum measurements and the gum health and the teeth. It's very unique. It's a very, very comprehensive overview that you're doing of these patients. You're grabbing all types of different organ systems and then those 19 different blood-based values as well. So you get this outcome and you have this pace of aging. What is this test good for? What are people using it for? Just in their research, is it applicable to people in their everyday life? What have you seen and what are the applications?
Yeah, what we hope that it will be good for will be to serve as an outcome point for randomized clinical trials of anti-aging therapeutics. And the reason a test like this would be useful is because, if you really want to fight aging and slow down aging in order to prevent the onset of age-related diseases, you have to do the fight aging part before the diseases start. So you'll be trying to intervene with people who are still in the middle of their life, not people who are very old. But if your randomized clinical trial, let's say of a drug, works, how will you know? Because you wouldn't want to wait 20, 30, 40 years to see if they get sick or if they die. The trial participants. Sounds gruesome, but that is what we need to see in order to have a drug approved to fight aging. The kind of measure that we have devised really does track that deterioration of all the bodily systems over midlife from 20s, 30s, 40s, 50s, and we hope to keep it going until the 60s. I think maybe that's the thing that we started out looking for is developing a measure that would be sensitive to change and could be used in clinical trials. Give it at the very start of the clinical trial, give it during the middle, give it at the end, and then continue giving the test years after to make sure that the effects of any successful anti-aging treatment don't fade out, but that people continue to stay younger. That would be a holy grail. So that's what we thought we were aiming for. To my surprise, there have been other uses suggested by people. So some people simply want to use a measure like DunedinPACE if they're trying to make a major change in their lifestyle. So joining a gym, going on Weight Watchers, stopping smoking. They would personally, as an individual, like to have a before and after test to see how well they're doing. So we have heard of people using it for that. And then the third use that has come to my attention is that there are some surgery clinics that have, in the past, when they're trying to determine who would be a great candidate for a very invasive surgery, they've been using chronological age and a frailty measure. But still, a lot of people come out of surgery and don't do very well on the other end. So they're experimenting with whether DunedinPACE might be a useful measure to give before surgery to help make that estimation. And what they'll be doing is following up their surgical candidates until after the surgery to see how fast they come out of rehab and how well they do in physical therapy. So I'm excited to see that use emerge, and we'll have to watch and see what happens.
Yeah, that third use is a great application. I would be very curious as well. always get so excited when I receive a notification that a new study has been published and I see that DunedinPACE being represented.
Me too.
There are so many different clinical trials going on. I mean, I'm sure hundreds and hundreds by now that are using this as a, effective way to measure, the before and after process of, like you said, an anti-aging supplement, maybe in a clinical trial or even personal use, right? If you want to make a change and then see if that change is actually affecting your aging in a positive or maybe not so positive way, it's always great to get that feedback to know maybe I need to change something or stop doing X, Y, or Z or add this into my diet. So I think it's a great tool that anyone could really use.
Yeah, we're cautiously optimistic. I've done things in science. My career is long enough now that I've done things in science that failed spectacularly or that looked pretty good at the beginning, but then flopped. I guess I wouldn't be shocked if DunedinPACE turned out not to be useful for clinical purposes, but we're cautiously optimistic, and we have heard of quite a few groups, there were 24 research groups that are not my personal research group who have now started using it. So all eyes are on them to see what they find, because that's really the acid test. You don't want good findings from the original designers, because of course we're biased. You want to see the findings from people who have no skin in the game.
Yeah, we'll have to wait and see what they come up with. So I'm excited for the results, but I love cautiously optimistic. That's a great way to look at it. And can you talk about the current collection method? And then I'm sure people are also wondering, what is the retest window as well? When can they do a baseline, maybe take a supplement, or like you said, go to the gym, go on Weight Watchers, and then retest again?
Yeah, this is a huge question. So the data collection for implementing the test right now involves having your doctor draw a blood sample. We are working on a version that could be used in cheek swabs or in saliva, and things. Again, look, I'm cautiously optimistic. Things look pretty good. It's turned out to be harder than I thought to do that, just because there are very few large studies that have collected both blood and some other tissue, because usually it's quite expensive to do DNA methylation arrays, and so nobody wants to do them twice. They'll choose either saliva or blood, but not both. So if anybody listening here has those kinds of data, we hope they'll help us out. But so far, the 2 or 3 data sets that we have found are working really nicely. But today, if you wanted it today, you would need a blood test. What was the next part of your question, Hannah? I've lost the end.
Yeah, no worries. I'm throwing a couple questions at you at a time. The test window. So when can someone take a baseline?
Right, the test window. At this point, we don't really know what the test window is. Again, because repeat of DNA methylation arrays in large cohort samples is still, rather expensive for people working as we do. So we have, in our own research, repeated the DNA methylation every 5 years, but of course that's not very helpful. If you really want to use the test much more close in time than that. We do know that the calorie study, which was a study of a randomized clinical trial in which the treatment arm participants ate under 1,800 calories a day for a year. It did show on repeat testing after 1 year, it showed slowed aging, whereas the people in the control group continued eating as normal, whatever they wanted, and their aging continued going forward at the rate of 1 year biologically per 1 year chronologically during that period. So there's one example out there right now suggesting that you can repeat it after a year and detect a dietary change. This is the the place where the research needs to go is pinning down how frequently we can repeat this test and how fast we can expect it to change. Sorry, I can't say right now.
No, definitely. And I think the reason I asked too is because people always want something quick, right? They want to be able to see changes and know that what they're doing is helping. So I think from some other data as well, I've seen people even do it, baseline, do some type of therapy or undergo some type of surgery, and then even do it a couple of days after as well. So I'll keep you updated with my conversations I'll have with those researchers. And some things I've seen in the literature as well is maybe 8 to 12 weeks, maybe a sweet spot. But I think, again, we need some more defined evidence for that. So we'll keep that question open-ended for more.
That sounds great. I know when you're doing interventions that involve behavioral change, let's say stopping smoking or, going on a diet to lose weight or adopting a new course of physical activity and exercise program, people need feedback really soon. They need to see change to motivate them. Otherwise, if it goes on for weeks and weeks of suffering without any kind of change, that's really discouraging. So what we're hoping is that DunedinPACE will have a good shot at showing change in the short term. But I can't myself, I haven't done an intervention yet to prove that.
Absolutely. No, completely understand. So I think you hinted at a couple of these, but according to the research, what tends to accelerate the DunedinPACE? What really makes, when you said speedometer, I think of like a rabbit or a hare and like a turtle. So what makes it go closer to the rabbit or the hare?
Right. Okay. So there are papers coming out in the literature. Some of them are in preprint form. Some of them are already published, showing that DunedinPACE speeds up when people start smoking. It speeds up during pregnancy in one study. It speeds up when people have COVID or are in the hospital for COVID, one study suggested. And a study identified that it sped up when people had traumatic surgery for a hip fracture. Those are the kinds of things that are starting to appear in the literature. Another study showed that when people had very severe economic loss, like losing their job or losing their paychecks, that the stress of that was associated with the speed up of DunedinPACE. Each of these has only been shown by one study so far. So again, it's really early days. The measure only became available for people to use at the end of 2020. So there hasn't been much time for research yet, but there are a few papers showing instances in which it has sped up in other people's studies. What slows it down? Going on a Mediterranean diet slows it down. Eating less than 1,800 calories a day slows it down. Those kinds of things.
Yeah, it's interesting that you mentioned the pregnancy because I work with a lot of people and helping them interpret their biological ages or their DunedinPACE. And it was in the same week where I saw 2 women have major accelerated DunedinPACEs. I'm talking about 1.2, 1.3. I was a little nervous to speak with them, actually. I was really trying to figure out and look in the literature, what could be speeding this up. And
wow.
Yeah, I ended up talking to both of them and they were both pregnant. So it was just mind blowing that the pregnancy can really make that tick. You truly see accelerated DunedinPACE or accelerated aging.
That's interesting. And, that's such an interesting avenue for perinatal researchers to follow up on because, you don't like to think of aging while you're pregnant. It's probably tapping into some other kinds of physiological changes that the body is undergoing. So we may, that may give us a different interpretation of the biology. That's fascinating.
Very fascinating. And I want to mention too, because you made a good point there, the follow-up, right? Again, getting more of that longitudinal data. we ended up actually testing one of the women about 6 months after she had her baby, and the DunedinPACE went from, again, 1.3 back down to around, I believe it was around 1.03 maybe, or it was right on the cusp of 1. So it reversed a lot, but probably may even take more time than 6 months.
I love stories like this. I hope that they turn out to be, backed up by large epidemiological studies. But it's fantastic that we have hints pointing in that direction.
Definitely. So we touched on this earlier too, Dr. Moffitt, but can you point out just anything we may have forgotten about what makes the DunedinPACE different from other aging clocks? When people talk about aging, it's this big trend. It's this big popular word right now, in anti-aging space, longevity, prevention, medicine. Mm-hmm. You always hear, what's my biological age, or my biological age is. So I think it's also really important to start hearing people say, my DunedinPACE is, right? I'm aging mm-hmm. this fast biologically for every one chronological year. So can you point out any major differences we may have forgotten at the beginning between those two?
So one of the things that the clocks do, because they're based on the early clocks, they're trained on when you were born. That means that the aging, if your score turns out to be accelerated, the aging that happened that accelerated your clock and brought it to an older age now than what your chronological age is, could have happened at any time. So it could have happened in infancy, neonatally, in early life, or lately. We just don't know. So there's a lot of research trying to pin down the timing question. What we hope is, because DunedinPACE was trained on actual biological change in biomarkers over midlife, that it's more tapping into recent change instead of change that may have happened in utero. So the training is different. The proof will be in the pudding. So our group and other research groups are working on trying to pin this down, but that's the theory. Anything else that differentiates it from the clocks? The clocks give you an age score, and DunedinPACE gives you a pace score, which is sort of like a speedometer. How fast are you aging now? So it doesn't give you a number that is, say, I am 67. It doesn't tell me I am biologically 68. It tells me at the moment I'm aging at the rate of, say, 11 months a year, or 13 months a year. So it's the way that we think about the score has got to be a little bit different.
Right. I always call the first generation and the second generation biological age clocks more of your historical processing of aging, almost. And I'm not sure if that's a good way to look at it. I think it may be, because again, there's a difference where you could have really old biological aging, but you could have a slower DunedinPACE, which means at some point in your life, you definitely had accelerated aging, but at this current moment, you've brought that back down. So you're working on bridging that gap between your biological age and your chronological age.
Yeah, that's a really clear and nice way to say it. And as I say, this is all kind of like, this distinction is in theory. What we need to watch is find out whether the studies that are looking at effects of pre-birth, things like low birth weight, or those kinds of factors, maternal stress, on the clocks and DunedinPACE, if they generate similar findings, different findings, it'll be interesting to see. Or if the testing the clocks versus DunedinPACE on more recent interventions, where people have really changed their lifestyle or started taking an anti-aging medication, are the findings going to be similar or different? So we're watching that.
Yeah, it really will be interesting. I'm excited about all of the epidemiological base studies being examined at the time as well. So it'll be nice and cool to look at the data. So what's next for the DunedinPACE? I know you're taking another round of all of those organ systems and then the 19 different blood-based biomarkers at age 52 of the cohort. But what else? What's next?
Well, with any new measure, you want to push the boundaries on who it's good for, who it's valid for. So my team is working hard on testing whether it works the same in different ethnic ancestry groups, and whether it works the same as well in babies, children, adolescents, as well as midlife people, as well as very old, much older adults or the elderly. So we need to know, how does it perform at different stages in the life course? Hopefully the same. So far it looks like the same, but we're working on that. And with the ancestry groups, of course, you want a test that can be used for everyone and not just limited to whites. I have to say that the Dunedin study, where we developed DunedinPACE, was limited to white New Zealanders, but it looks as though when we've applied DunedinPACE in African American samples in the United States, and as far away as there's one paper that's coming out of the Philippines, so that's another ethnic group, it looks as though it's performing well in those other ethnic groups as well. Probably not, it won't always be perfect, but we'll pretty soon have a bigger picture of how far we can push the envelope on using it. So that's what we're doing. And then the other thing we're doing is we're inviting our 1,000 participants to come back into the clinic and spend a full day with us over the next couple of years. And soon we'll have more data on their outcomes in their 50s, which is very exciting.
Awesome. That all sounds great. Yes. The more data, the better, right? The more we can understand and learn and really make it applicable. So
yeah.
Very exciting. And the very, very last question, I ask everyone this on the end of my podcast. Dr. Moffit, if you could be any animal in the world, what would you be and why?
Any animal.
This is a curveball question.
That is the curveball question. That's a great one. I think I would love to be a gazelle because it's everything I'm not, which is very fast and very elegant and and strong. So maybe it's an alter ego kind of thing. I need a gazelle avatar.
Gotcha. Yeah, just a fun question I like to throw in there at the end for everyone. So this has been great, Dr. Moffit. We've come to the end of this amazing podcast. So for anyone who's listening and you're interested in taking the DunedinPACE, True Diagnostic does offer 2 products, which contains this amazing output. There's the TrueAge Complete and there's the TrueAge PACE. So you can use the code Everything Epi for 12% off. I'll put that in the show notes for each of those products. In addition, the algorithm to calculate the DunedinPACE is on GitHub, where any scientist with epigenetics expertise can access it to run their data for research purposes, so long as there's no commercial use intended, since True Diagnostic has those exclusive license and rights to the algorithm. So thank you for joining us at the Everything Epigenetics podcast. And remember, you have control over your epigenetics. So tune in next time to learn more about how. Thank you, Dr. Moffit.
Thank you, Hannah. This was absolutely terrific. I so enjoyed it.
Thanks. Bye-bye.